Hello. Today with the new normal, we need to come with new health solutions. Genetic Analysis is a Norwegian molecular diagnostic company which has developed and patented the GA-map technology platform to map gut microbiota from human fecal samples. We have core competence in detecting bacteria and viruses in the gut. We have been the first worldwide to develop and clinically validate a certified test for the diagnosis and characterization of this biosis in patients with gastrointestinal disorders such as IBS and IBD. This test has been used in many clinical trials and reported in several scientific publications. As a response to the COVID-19 pandemic, we have developed and launched the first CE-marked RT-PCR test for the detection of the 2019 novel coronavirus in stool samples. The GA-map COVID-19 Fecal Test is specific to SARS-CoV-2 virus with a selective amplification of 2 gene regions, is a non-invasive test thanks to the fecal sampling, and has been developed and validated with human stool samples from confirmed COVID-19 patients. As you know, COVID-19 is not only a respiratory disease, but rather a multi-system disease. Patients report typically gastrointestinal symptoms such as diarrhea, abdominal pain, and vomiting. SARS-CoV-2 RNA has been found in fecal samples of up to 50% of COVID-19 patients, and the virus can be detected in fecal samples for up to 40 days after onset of symptoms. It can infiltrate gastrointestinal cells, which may promote viral infection. Our test is an important supplement to the current molecular and serology tests already out in the market. Respiratory tract testing are the current standard and first-line RT-PCR detection test, though a short window detection with variable clinical results due to the distribution disparity of the virus across the respiratory tract. RT-PCR stool testing is a non-invasive tool with a prolonged detection window, as fecal viral shedding was reported to range up to 3 weeks after a negative nasopharyngeal swab. So, the GA-map COVID-19 Fecal Test is an easy-to-use home sampling with fast analysis which can be run locally, at an accurate detection level with high specificity and sensitivity, includes several quality controls, has a prolonged detection window of positive samples compared to nasopharyngeal specimens. Let me show you an interesting clinical case. We know that SARS-CoV-2 RNA has been detected in fecal samples of COVID-19 patients even after respiratory samples were tested negative, suggesting that the human gastrointestinal tract can serve as an important viral reservoir. In the following example, we have the case of a male healthcare worker, aged 30, with mild symptoms. He was confirmed COVID-19 positive with nasopharyngeal sample testing. In accordance with hospital policy, he was placed in home isolation for 10 days, after when he came back to work. During the same period, he provided us with stool samples for testing for SARS-CoV-2 presence. What we've observed is even after its quarantine period was over and he was back to work on day 11, he was still carrying the virus in his gastrointestinal tract, and this for several days. This raises the concern that a COVID-19 positive individual could still be infectious through the possible fecal-oral transmission route despite negative nasopharyngeal results. Thus, the GA-map COVID-19 Fecal Test will help you in excluding this worry. As healthcare professionals, why should you consider stool testing? First, for the avoidance of virus contamination with the screening of incoming patients for endoscopy or colonoscopy procedures, for example, as for the reinforcement of a safer working environment. Secondly, which action will you take if you know that a patient or one of your employees is still a COVID-19 carrier? Can it influence your return to work policy? Thirdly, stool testing is a good and easier alternative for pediatric patients and for the elderly, for whom nasopharyngeal swab can be an unpleasant experience. Thank you for your attention. May you need further information, please feel free to contact us.